Sudanese political analyst and the founding director of Confluence Advisory, a think and do tank in Khartoum. She joins us live from London. Thank you so much, Kholood, for making the time. Now, we're talking about a collapsed health system. We're talking about the Prime Minister's proposed peace plan to the United UNSC, UN Security Council. Just what does this latest development mean for the people of Sudan? Is it in any way a glimmer of hope?
It doesn't seem like it. The prime minister out of Port Sudan, went to the United Nations really when a lot of people were entering Christmas mode and holiday mode. And he presented a plan that effectively looks good on paper, a Sudanese dialogue, a ceasefire, a genuine ceasefire that sees an end to hostilities, at least temporarily, in order to allow for humanitarian aid to come in. But effectively that rests, as he says, it's conditioned on a surrender by the RSF. Now, the RSF have the momentum currently militarily. They've, of course, taken over Al-Fashir in late October, and they're making serious ground in Kordofan. They're unlikely to acquiesce to a surrender, what is effectively a surrender deal from Port Sudan. And so, effectively, it's a non-starter. And at the same time, as your report says, we have, diseases like measles and cholera killing a lot of people. We have the collapse of healthcare systems. We have the collapse of even humanitarian systems where the UN and international NGOs also can't respond.
So then the question would be, where does this leave this whole situation? Sudan now being the world's largest humanitarian crisis, the world's largest displacement crisis, because like you rightly said, Kholood, the plan is talking about the withdrawal of the RSF from the territory it controls. But we're seeing the contrary. We're seeing RSF seizing more ground. We're talking about Al-Fashir. We're talking about Kordofan, like you mentioned. We're talking about seizing the largest oil fields in the south. Where does this leave all of that?
Well, effectively, it leaves us having two separate conversations. The warring parties and their supporters, both in the region and further afield, are having a very different conversation than the humanitarians are. Effectively, the politicians and the armed groups are each trying to eke out a military advantage territorially because they know that the Trump administration will push them towards a ceasefire deal, and they both want to put themselves in an advantageous position. Currently, it looks like the RSF are able to assert much more power on the ground. They're potentially, according to the United Nations, very much on the verge of taking Al Ubaid, a large commercial town in Al Ubaid region, in the Kordofan's region. Now, in terms of the humanitarian space, we're seeing that WFP is saying it's going to cut its ration to 70% initially in 2026, down to 50% in areas that don't have famine. We've had a famine in Sudan since August of last year. The Sudanese Armed Forces, as the de facto authorities, has not acknowledged the famine, and that has stopped a lot of the aid access. The RSF also has limited access massively. And of course, the instability, particularly in RSF areas where the needs are greatest, the RSF has limited aid access there. So civilians are paying a really heavy price due to the maneuvering of the different armed actors, in particular the SAF and the RSF, and also the inability of the international community to respond. The humanitarian envelope for the UN right now is only about 36% funded in, as you said, the world's largest humanitarian and hunger and displacement and protection crisis.
Absolutely. Thank you so much, Kholood Khair, there for your time and your insights.